Hi, I'm Dave. We are now back for another part of this process. So coming back to the patient's room, I will do some hand hygiene. My infusion for my piggyback is complete. So I would close this off, remove the piggyback, dispose of that, put my main line back, and reset my drip rate on my main line and let that run. So my main line is done. She has her 2 liters of solution that she's gotten. I have now gotten order to saline lock her. So we're going to complete this process and leave the IV in process. So I would make sure she understands what that is, what we're doing, make sure this is closed up. We're closed up. I'm just, at this point, I'm going to come in and I'm going to need to flush this. So I'm going to, I'm all clean, I'm all ready to go here, but I'll get my flush ready in order to lock it. And I'm gonna need some gauze. Gauze ready and an alcohol pad. I've done some hand hygiene. They're good to go. Put on the gloves. So I am going to take a piece of gauze and put it under this IV line. Going to disconnect the IV line. I'm then going to take my alcohol swab and clean that port and let that air dry. I'm then going to take my saline, connect that to my port, and I'm now going to slowly flush and assess while doing so the 5 mLs of flush. So that is good to go. Flushed, saline locked. I also have an order, normally that would be one process, but we're just, for expediency, we have an order. This patient is having some pain, so she is to receive Dilaudid per her provider. So again, this is where the 6 rights of medication come in. I'm going to give the right medication to the right patient, the right time, by the right route, with the right dose, and for the right reason with the right documentation. So this provider has ordered that she received Dilaudid. She's going to get 2 milligrams IV push, Q2 for pain related to coughing. And the way we did the math, she's going to get 2 milligrams per milliliter, and we're going to dilute with 2 milliliters of normal saline for this IV push. So it's going to be 3 mils total, and she gets 1 milligram every 2 minutes. So this is going to be a 4-minute push. So that being said, I'm going to do my 3 checks of medication, check my patient ID, make sure the patient understands the procedure, check my allergies, make sure she doesn't have allergies. There's no latex, no penicillin, those are her allergies. I'm going to clean with alcohol the tops of my containers, take another swab, clean my medication port. I'm going to remove my appropriate syringe. I will go into the, so this is my Dilaudid, this is my saline. I'll go into my saline and remove 2 milliliters of normal saline. Perfect. Then I will go in and I will remove my 1 milliliter of Dilaudid. check my numbers, check my medication. We're good. So now I need to flush this. So I would do the swoop and scoop method for my needle. I will take out my flush. I'll take my alcohol wipe, clean my port. I'm going to flush this with 5 milliliters of saline, making sure that it's patent. We don't have any redness, infiltration. Clean my cap with an alcohol wipe, double OK method. Remove my cap, insert my medication, and then I'm going to push this over 4 minutes, 1 milligram per 2 minutes. 4 minutes have gone by, medication's in, goes into sharps. Take another alcohol wipe, clean that off, take my flush, assessing my patient, reaction to medication, everything's beautiful. I will now flush 5 milliliters slowly and appropriately. Boom. So we are done. We've given our medication. We can now document that we gave the medication in our chart in DocuCare, which is my favorite. I can't wait to do it. We'll be back for our last video.